our cop mayor, Eric Adams, boo, yes, thank you. Eric Adams has identified people experiencing mental instability as an impediment to public safety and has deployed police to respond, which we all know is cruel and doesn't help anyone except perhaps perceived property values. So at the same time, the nonprofit left demands more funding for social workers in schools, for more psychiatric beds, for better mental health care in jails and prisons even, and for non-police responders to mental health 911 calls. Some of that sounds great. And some of that, we join in those calls. But below the surface, some of it is kind of hard to tease apart. And to be truly honest, I don't know what the socialist demand is here. But I do know that we have pieces of it. And I know that we can draw on our expertise from different corners of the world as socialist historians, as abolitionists, as public health experts, and as mental health care providers and disability activists. So that is what we're here to do today, to start piecing together an anti-capitalist vision for mental health, starting with prevention. And wising up to where the solutions that mainstream Democrats, progressives, and nonprofits, where those might or might not match up with what we as socialists understand about mental health. So I also just want to say that this event was conceived of before Jordan Neely was murdered. And so just want to leave some space for that, for the grief and anger that we are all feeling, and also leave some space to think about the work that folks here have been doing and organizing, for everyone who's been out in the streets protesting, folks who've been met with really aggressive police violence, and also to just sit with the fact that we put this event together and started thinking about and asking these questions before Jordan Neely was murdered, because in a sense, we were able to anticipate that kind of thing, because our mayor and our governor and our media created the conditions for Jordan Neely's murder, both setting him up to be in that position and setting his killer up to then be justified in those actions. And that is horrifying, and that is why we're here organizing together. So that's why we're here. Thank you so much. Yes. And thank you so much to all these brilliant people up here with me. I'm going to try to go to the next slide. Great. Okay. This is our quick agenda. We're going to keep it short. You'll hear from some of the folks up here and on Zoom with some short presentations that give some grounding. And then after that, we're going to open it up to a panel discussion and open it up to audience questions. The way we're going to do that, since we have a lot of folks on Zoom and also a lot of folks in the room, is that on Zoom, send your questions to the moderator. I think someone has Stack as their Zoom name. And so send your questions to the person who is named Stack. And then they'll have a mic here to read those questions out. And if you're in person, you should have a note card and a pen. If you don't have that, your neighbor might. You can work together. Write questions as you think of them and pass them to the ends of your rows and up to the front. We'll collect them. I'll have them and then kind of like shuffle them together and ask the moderators. At 8:20, we're going to come back together for a little figuring out like what do we actually do, and then go from there. Oh, sorry. Okay. Just starting with some community agreements. I bet these are familiar to those of you who spend a lot of time in movement spaces and group meetings, but just wanted to be explicit about them. The first is assume good faith or best intentions. So if you hear something weird, just be generous with the person who's saying it. The second is one of my favorites from a DSA space that I'm in. Debate is healthy. That is how we learn together. So be open to critique. And also, if you are challenging someone's ideas, do so in good faith, not just to be a thorn in someone's side. And I think a lot of these are for us up here because we're going to be doing a lot of the talking. Next one is to use I statements, especially in this time when we're talking about mental health, disability, public safety. Speak from your perspective rather than assuming that your experience is universal. And lastly, to use person-first language. So we can talk about people who use drugs. We can talk about someone experiencing homelessness rather than centering the disability or the condition, centering the person. Cool. With that, I think, and I think it takes us to Seth.
Hi. Thanks so much for organizing this. So I want to very quickly, because none of us have that much time, just kind of throw out three things that I think we should be thinking about, three categories of things we should be thinking about as socialists and from a socialist epidemiologic perspective. So the first one I'm going to spend the least amount of time on, but I do want to just kind of throw it out there, which is that we need to be thinking. It's hard to know what a socialist response to mental illness should be if we don't have a shared understanding of what mental illnesses are. And so I think the science, although not so much the practice, but in science, the sort of debate over nature and nurture is essentially over, and we need to be thinking dialectically about mental health and mental illness. And so we need to think about mental illness as being 100% biological and 100% social, and kind of favoring one explanation over another can have real consequences. The biological perspective, which is sort of capitalism's favored perspective on mental illness, sort of individualizes mental health problems, locates them inside the individual, and neglects sort of people's social context and social conditions. Whereas thinking about mental illness as completely socially constructed can also have consequences, although I would say they're less severe, but it can also sort of deny that some people really do need medication and medical help. So moving on. So now the kind of epidemiology. So class relations under capitalism are horrible for our mental health. Epidemiologists, as opposed to some of the clinicians we hear from, think about populations more so than individuals. But I'll just kind of throw up a couple of slides to illustrate this. So this is the global burden of depression from 1990 to 2017, divided by sort of whether a country is low, middle, or high income. And you can see that depression globally has been on the increase, sort of coinciding with increases in late capitalism, neoliberal capitalism. So on the next slide. It's also something that we've known for over 100 years from Engels actually all the way to the present, that there is a social gradient for almost all mental illnesses. So this is a chart that shows that as income categories increase, the prevalence of a host of mental disorders decreases. So from alcohol dependence, anxiety, bipolar, even schizophrenia, which a lot of people think of as sort of the most biomedical of mental illnesses, we see a pretty clear social gradient, which speaks to how social conditions cause mental illness. We also know that there are occupational disparities in mental illness and alcohol use. So this is impossible to see, but certain jobs are associated with higher odds of drinking, problematic drinking, serious mental illness, moderate mental illness, and certain jobs are protective against those conditions. And in the next slide, you can kind of get an idea of why, which is that working conditions affect mental illness and alcohol use. So these slides show basically anything to the right of the vertical line is worse, and anything to the left of the vertical line is protective. But jobs that are high in automation are associated with more heavy drinking, and jobs that are higher in authority, autonomy, and expertise are protective for mental illnesses. So jobs with less of those things are worse for mental health. And we also know that working conditions pattern mood disorders and sort of class relations pattern mood disorders. And so this was a study that found that middle managers in particular, given their class location, actually had worse depression and anxiety than both workers and owners, given that they were facing antagonism from both bosses and workers. So just more evidence that class conflict and class relations affect mental health. And then the third thing that I think I'll just touch on very briefly is that there are a lot of liberal and progressive reforms that may sound good, but are in fact carceral and medicalized social problems, right? So I think as socialists, we need to be thinking, for example, will increasing mental health treatment increase the number of affordable housing stock or social housing stock? No. Will increasing mental health services stop white supremacists from murdering people? No. So I think we need to be very clear about what are problems that can be solved at the individual level and what are problems that need to be solved socially and collectively. And mental illness, I think, often gets placed in the individual box when it is in fact a social problem. So I'll stop there and pass it over to John.
All right. Thank you, Seth. Just make sure I'm out of the way a little bit here. So first of all, I'm really grateful for the invitation to come and speak with you all. I'll be brief as well to kind of keep the show rolling along. I think it's important to start. So as an epidemiologist, I do study mental health, but I also study policing and kind of how these two things, especially in our current climate, tend to go hand in hand, especially in kind of media narratives and kind of the public conversations that we're having. And I think it's important to note, I can start kind of from my foundational point is that, you know, there are very strategic reasons why these kind of conversations happen together like that. It's important to understand that for many folks in power right now, the stigmatization of mental health becomes very convenient, especially when we're having these conversations about public safety, because it becomes and Seth actually alluded to this, it becomes a mechanism to take what's frankly a societal issue in terms of crime and safety and turn it into an individualized issue around, well, that person had mental health issues, right? And so it kind of allows folks in power to absolve themselves of having to address these kind of structural issues. And so I think the first foundational point that I always want to start with these conversations are, and I think many folks may be familiar with this, if they're not, you know, people with mental illness are more likely to be victimized by violent crime than they are to be the people who are perpetrating it. And that's something that you will fully miss by kind of the rhetoric that happens time and time again. This is just one example of a study where they actually, and even this one example, cuts across 5 different studies where they pulled data on this, but it's actually a finding that is pretty robustly seen time and time again. The people who are actually, you know, having, you know, different issues with mental health, who are struggling with mental health, are far more likely, on average, to find themselves on the receiving end, and as opposed to the people who are out there who we need to be kind of concerned about. Next slide. nonetheless, by framing people struggling with mental illness as a safety issue, it justifies this idea of, well, we need to find a way to warehouse them. We need to find, and it goes on one extreme, it's, policing, criminalizing them, putting them in jails. On kind of the other side of the more, I don't know the word I want to use for this, the more respectful, the more, whatever, warehousing them in a facility, you're still warehousing individuals, right? You're removing people who are, for whatever reason, deemed inconvenient. And the thing that I really want to point out is policing mental illness in itself is an act of violence. We've seen that borne out again and again in the data. So this is a little infographic from the Washington Post. They've been keeping track of people shot and killed by the police since 2015. At this point, it's been about 8,500 people shot and killed by the police since 2015. Of those people, 1 in 5 are experiencing some form of documented mental illness in their life, right? And so many of those people who were killed were actually killed in, when police were responding to calls for help, and so this idea of, how we frame who has issues, concerns of safety, especially when we're talking about mental health, the data and the public narratives just often don't align. Next slide. And so the last point I want to make here is because we do have so much of these conversations around, policing and mental health and safety, and these kind of 3 things go hand in hand, but the direction of that conversation, for the most part, is this idea of people with mental health issues are not safe, and therefore we need to send police to handle the issue. And something that myself and my colleagues have been really thinking about is how this political decision of increasing policing, increasing kind of surveillance, to assume that that's a benign exposure, that's not itself going to have impact for folks. And so we've really been trying to answer this question about, like, well, to what extent are these political choices actually having their own impacts on people's mental health? And we published a kind of review of the data. This is myself and some colleagues, Seth included. We published this earlier this year, where we just started looking at the evidence around this idea of, what is the effect of this kind of broadened and increasing exposure to policing on people's mental health. And these are just a handful of findings that we came across. One, adolescents who just witnessed kind of what we might think of intrusive stops. So these are things like, aggressive frisk, or maybe someone who's experiencing police brutality. Just witnessing those type of stops was associated with having elevated psychological distress for those individuals. There's been a study published in 2021 showed an 11% increase in depression-related emergency department visits for Black people in the month following documented killings, police killings of Black folks. And we've seen evidence in a study published in 2022 of increased rates of suicide for Black people in the months with at least one documented police killing of a Black person in their kind of within their geographic space. These are just kind of a few highlights of what's a broader set of a growing body of evidence of some really non-trivial, data points for this relationship of policing exposure and worsening mental health. And so I think that just needs to be part of this conversation as well. And I'll pass it on.
All right, thank you so much. And I realized in our haste to get started and troubleshoot some of the technical issues, didn't properly introduce folks, but so far we've heard from Seth Prins and John Pamplin, who are both brilliant epidemiologists, professors, researchers who study, as you have now seen, the structural drivers of health issues that are kind of at the intersections of all these things that we're talking about today, and of sort of mental health race, substance use. These are some of the things that I heard you all talk about both before tonight and read, and whenever you publish papers, I see them on Twitter and try to understand as best I can. So we're really, really lucky to have them both here with us. It's my understanding that Seth also at one point sang in Solidarity Choir. So yes, pretty fun. We will make sure to get the slides out to everyone who RSVP'd tomorrow, so that you can also go a little deeper into some of this research, because it's really wild, the deeper you go. I'm going to try to take us back to to Brynne, from the Disability Working Group. And so by way of intro, as I zoom back through the slides, look, there you are. This is so perfect. But Brynne comes to us from DSA's Disability Working Group, doing important work sort of on DSA's national level. There are also resources there that you probably already got today, but we'll include more in the follow-up email tomorrow from that working group and how you can plug in, because this is all continually relevant. All right, take it away.
Can you hear me okay? Okay, thank you. So yes, I'm Brynne. I use she, her pronouns. I am a person with disabilities, and I work in vocational rehabilitation, assisting people with disabilities and those in recovery. I'm looking forward to the opportunity to discuss a bit about the relationship between disability and mental health. I'm honored to be here with you all today, representing the DSA National Disability Working Group as the member-elected communications officer. The Disability Working Group of DSA is committed to a democratic socialism that includes full participation for all people, regardless of ability or impairment in all aspects of life. From each according to their ability is at the very heart of the socialist vision, and we actively work for the inclusion of disabled people in all aspects of DSA, in all settings where DSA participates, including full accommodation of in-person and online meetings. So, capitalism and disability. Society and capitalism create categories of abnormality. Imperialism and colonization directly creates disabled people, physical, mental, emotional, trauma, injury, and illness. So why is this helpful to capitalism? Well, it causes problems and then it makes money on fixing it. Profits on treatments, on the medical devices and so-called cures. The construct of disability serves as a tool to keep people divided. Ableist culture, where disabled people are seen as worthless, ensuring that we advantage the capitalist class and bosses. Next slide, please. So material conditions under capitalism, the class perspective, the working class versus the owning class. Disabled people overwhelmingly experience poverty, unemployment, homelessness, incarceration, nationalism and immigration, housing insecurity, unaffordable education, employment insecurity, low wages, high cost of living. And how can these conditions affect mental health and healthcare? Mental illness and disability caused or worsened by these conditions, the pharmaceutical industry and healthcare access and lack of coverage. Next slide, please. So the socialist perspective, disability and mental health, how should it be? So it should be about disability justice. And this was from Sins Invalid. And the 10 principles include intersectionality, leadership of those most impacted, anti-capitalism, commitment to cross-movement organizing, recognizing wholeness, sustainability, commitment to cross-disability solidarity, interdependence, collective access, and collective liberation. It also includes deinstitutionalization and healing justice. Thank you.
All right. Thank you so much, Brynne. I am going to zoom back through these slides, but actually I think that Phillip, who's up next, doesn't have slides. So lucky us. So up next is Phillip Henry, who is a socialist historian and going to speak to us about Red Vienna and kind of a possibility from the past or maybe for the future. So if you're ready, I'll let you take it away.
Thank you. Can everyone hear me?
Yes. Yes.
Great, thanks. And thanks so much for the invite and for these wonderful presentations. So I am going to briefly, hopefully very briefly, introduce an episode in the history of the 20th century that I think is of particular relevance to our efforts to envision anti-capitalist approaches to mental health. This episode was an experiment in municipal socialism that emerged in the Austrian capital of Vienna in the wake of the First World War, an experiment that would come to be known as Red Vienna. This experiment would last only a decade and a half, from 1919 to 1934, when it was destroyed along with democracy by clerical conservatism and Austro-fascism. But despite the fact that it was really tragically short-lived, I think it's of quite vital importance to our discussion today, both because of the inspiring examples it provides, but also for the cautionary lessons that it imparts. First, a little historical context, I think, will help to frame this history. Now, Red Vienna was the creation of the Social Democratic Workers' Party of Austria, historically one of the largest and especially intellectually most influential social democratic parties in Europe from the late 19th to the early 20th centuries. It was also, importantly, an avowedly Marxist party. It was committed to the goal of the revolutionary overcoming of capitalism, but through democratic means. Theirs was very much a revolution by way of the ballot box. Alongside of this electoral program, however, the Austrian socialists pursued the aim of social transformation within capitalism. In the wake of the war, the SDAP, the Social Democratic Workers' Party, achieved an outright majority in the Viennese municipal elections, and they used the support to embark on an experiment that one commentator referred to as socialism in one city. Basically, in the words of one historian, this was an attempt to convert Vienna into a prefiguration of the socialist utopia of the future. Now, the Austrian socialists would never attain a majority in the federal elections of the First Republic of Austria. And this, of course, placed significant constraints on what they were able to accomplish. They were never, for instance, able to socialize or nationalize key industries in Austria. And ultimately, capitalism remained very much in place. For this reason, critical historians have viewed the politics of anticipatory socialism in Red Vienna as very much a compensation for their powerlessness, particularly in the face of an entrenched capitalist bourgeois order. But what is really undeniable is that the Austrian socialists delivered tangible material benefits, ones that significantly improved the lives of their working class constituents. The most visible testament to their success in this endeavor was the construction of so-called people's palaces, massive residential buildings that the municipality constructed in the working class suburbs and the outskirts of Vienna, and that provided much more salubrious living conditions for the working class, who previously had been basically herded into horrible tenements. And it did so. These new buildings provided much better conditions at a fraction of the cost, significantly reducing the amount of income that workers had to devote to paying rent. Perhaps the most impressive achievements, however, lay in the field of public health. In Austria, as in Germany, The Social Democrats were the chief architects of the democratic welfare states that were established in the aftermath of the First World War, and that lay down as a constitutional principle the right of the individual to certain forms of social support. In Red Vienna, however, the Austrian socialists were able to push much further in this vision. They constructed an integrated, comprehensive system for the provisioning of communal welfare services. Over the 1920s, they created or expanded clinics, hospitals, and sanatoriums. They also established or oversaw an expansive network of counseling centers, of educational counseling clinics for troubling youth, marriage counseling centers for reproductive health, a massive child intake center for neglected infants and children who were effectively taken under the protection of the city itself. Through these endeavors, through these different initiatives, the socialist municipality devoted considerable resources to the treatment of mental disorders. Psychiatrists, psychologists, and psychoanalysts were often sort of the leading figures staffing and organizing these efforts. But much of the initiative for expanding mental health services in Red Vienna, in fact, came from outside of the formal structures of municipal politics. They came, at least initially, from a politically radicalized civil society. Now, there were two major associations, two movements or schools of psychology that dominated the field. These were the psychoanalysts, followers of Sigmund Freud, and the individual psychologists, followers of Alfred Adler, a former adherent of psychoanalysis who broke away in 1911. The Adlerian individual psychologists were actually the more influential of the two schools in Red Vienna. With the support of the Social Democratic Party, the individual psychologists established 28 child guidance clinics throughout Vienna over the 1920s and early 1930s. They also organized a series of outpatient clinics that offered free or low-cost treatment. They established suicide prevention centers, and they also played a central role in the reform of the public school system. While the Freudians were less prominent in these fields, they too established both a child guidance clinic and an outpatient clinic that they called the psychoanalytic ambulatorium. Following Sigmund Freud's express wishes, treatment in this clinic was offered free of charge in the express hope that it would make analytic therapy available to what he called the wider social strata. So previously, psychoanalysis had been very much a privilege of the upper and middle classes, or upper and middle bourgeoisie. And at this moment, what we see is a concerted effort to extend psychoanalysis to the masses. Now, what these different undertakings reflect is the extent to which much of civil society between the wars really lurched leftwards and was drawn into the orbit of social democracy in the wake of the war. In part, this was a reaction to the destructiveness of the war itself, which produced mass starvation, led to horrible epidemics, as well as causing mass trauma and bereavement. And as a result of this destructiveness, there was a general recognition that a much more ambitious socio-political response was necessary to tackle these problems. But it was also, I think, the sort of lurch leftwards of civil society was a positive response to the achievements of Austrian social democracy itself. I think we can think of Red Vienna as drawing together a host of progressive currents in civil society and really galvanizing them and directing them towards more, or directing them in more radical directions. Almost all Freudians and Adlerians at this time aligned their undertakings with the principles of the democratic welfare state, framing treatment for the mind as a right that the individual was owed from society. But many, especially many younger, more radical psychoanalysts and individual psychologists, envisioned their work as actually a positive contribution to the creation of a socialist society. But they were, however, also very cognizant of the limits of what they were doing, in particular of the disproportion between, on the one hand, the scale of the problem, of the ongoing mental health catastrophe of life under capitalism, and on the other, the limits of their own capacity as clinicians. At the psychoanalytic ambulatorium, the outpatient clinic, for instance, which was enormously popular, psychoanalysts were flooded with patients and felt completely overwhelmed by the need, the popular need for mental health services. And this disabused recognition of the limits of their therapeutic work pushed many to be very creative in its application, experimenting with new therapeutic techniques that they hoped would be more efficient or more effective. Others turned their focus in part away from treatment and towards prevention, focusing, for instance, on the prophylaxis of the neuroses through the dissemination of psychological advice and insight. Particularly, a lot of this was directed at teachers and parents and was channeled into a general socialist project reforming child and adolescent education at this time. Lastly, it also pushed many of them increasingly into politics as they came to see the socialist project of improving the living conditions of the working class as the most powerful means actually of combating the psychic suffering of the masses at this time. There's a lot more to be said about all of this, but I've gone a bit over time, so I can talk more about the lessons to be drawn from this later. Thanks.
All right, thank you so much. I think many of us can relate to doing some work and then the frustrations of that pushing you deeper into politics. So now what I'm going to do is ask each of our last three panelists to introduce themselves as I ask them a question. And this is kind of going to be our intro into the question and answer time. So if you haven't yet used that index card and pen on your seat to ask a question, think about it. If you have a question, write it down, pass it up to the front, or if you're on Zoom, write a question to the Zoom person named Stack. I'm going to kick it off with some questions that I have prepared, but really excited to hear what you all are curious about. But I will ask you each to introduce yourself. So the last three folks are really excellent socialist organizers within DSA, but also are all mental health practitioners and caregivers themselves. So I'm going to start with you, Stephen. Tell us who you are. Maybe we'll just do intros and then I'll ask you questions.
All right. Hey, everyone. I'm Stephen Dube, he, him. Thank you. I'm a social worker and I wear a few hats in DSA. I'm a member of the grievance committee and I'm also secretary of the Socialists in Office committee.
Awesome. Thanks. We just moved down the line.
Yes. Hey everyone, my name is Illapa, Sairitupac, he, they, social worker in Lower Manhattan, tenant organizer with Cooper Square Committee. And yeah, as a therapist, I did clinical work. I had a caseload of 30 clients, and many of them were formerly houseless or at risk of being unhoused.
Hi, I'm Christie Offenbacher. I'm a clinical social worker and a psychoanalyst. I split my time in my clinical practice between a public mental health clinic and a private practice.
All right, thanks so much. So Stephen, my first question is for you, which is, can you just tell us a little about what brings people into therapy?
Yeah, so in the fallout of capitalism, there's a common thread of what brings people into therapy, and it's often a sense of self-blame and guilt and not being productive enough and not feeling like their needs need to be met. And it's this sort of form of internalized capitalism that a lot of people have. And, you know, for example, it's very common for a client to come in and describe really exploitative work conditions and really unrealistic work expectations set for them, and then presented as, why do I mess up, sort of thing. And so, I think there's a, worry that maybe therapy will try and CBT the person out of their anger toward capitalism, but a good therapist will be validating and will make the person feel like they're not alone, and that their anger is righteous anger. And so a lot of the work is taking that internalized capitalism and externalizing it. But there's another way of viewing that guilt and self-blame and not feeling you're productive enough, which is that in and of itself is a coping mechanism for capitalism. And that guilt often reflects a desire to be responsible in a society that is not responsible toward others. It often reflects caring toward others, that then becomes something that's directed inward. And so we see the absence of people's societal safety net and people's material needs being met in the individual. And that's why it's also important to consider who doesn't come into therapy. And often people with narcissistic traits or sociopathic traits won't come into therapy. It's kind of very rare for them to enter therapy, and even rarer for them to do the work of therapy. And so, this all points to the socialist frame of mental health care being one of prevention, that there's a lot of suffering. There's not a lot of great care available. It's expensive care. And there are also people who never show up in the treatment office who, are causing harm. It could be your boss or someone with a great amount of power, and unlikely to seek help for that. And that's why we do want to shift to this preventative mode where people's material needs are met. And so people aren't suffering in the first place.
Thanks. I have a different kind of question for you, Christie, which is what kinds of mental health care are available to poorer folks, and how do people end up in that care?
Sure. So I think it's an important background or context for what we're talking about this evening to just touch on the obvious elephant in the room, the for-profit healthcare system that we're living and working under. The big thing to emphasize there, big surprise, is that when healthcare is run for profit, no one wins. And mental health care, I think, isn't a particularly acute example of the absurdities of our for-profit healthcare system. So on the one hand, even if you have private insurance, you're likely to encounter a lot of access or barriers to care. And then also you might find a provider who works well with you, and then you get divorced or lose your job and have to change providers. All sorts of issues there already. But on the other hand, we do have means-tested Medicaid for those who qualify for it. It offers free at the point of service care to so many Americans to whom it would otherwise be unavailable. However, so access to care is hypothetically less of an issue, but the care itself is variable at best. So I work at a public mental health clinic, and I have for 7 years. So I'm speaking a bit from what I've seen in that setting. Within a profit-driven system, the treatment modalities tend to be limited by cost-saving measures, where time is of the essence. Within these modalities, human reactions to complex and often inhuman living conditions are sort of broken down into functional categories so that a one-to-one intervention can be prescribed and implemented with the aim of getting the person back to work or back to life as quickly as possible. And then beyond just the therapeutic modalities, you also see a lot more of a reliance on psychopharmacology in clinic work. As you're saying, sort of the medicalization of what are properly social issues is egregious and really a tragedy insofar as it takes us away and takes the patient away from being able to consider the broader trends and influences in their environment affecting their experience. So there's a lot more that I could say about just like the treatment modalities, but in terms of there's also the clinics themselves and the type of environment that this is, which is overcrowded and understaffed. underfunded. So at my clinic, for example, you have at least like psychiatrists and therapists working alongside one another. You can't see a therapist without also, or you can't get prescribed medication without also seeing a therapist. So we're supposedly working alongside psychiatrists. However, we hardly have time for contact in the first place. Most of these clinics are structured with fee-for-service workers exclusively. They don't, they're only now starting to hire full-time employees. It's kind of a trend we've started to see in the last year or so. I'd be happy to talk about that more. There's a kind of very interesting history starting with managed care in the mid-90s, where you see a shift away from full-time employees who are really grounded in a clinic working with a somewhat reasonable caseload, but are actually like doing team meetings, meeting regularly with psychiatrists. The clinic, the contemporary clinic is much more chaotic. There's maybe a common meeting space, but no one's in there at the same time. And if they're in there, they're like just gulping down water quickly to try to see as many people as they can. So the workplace in these clinics is very hectic and stressful. So the kind of care you can imagine getting from someone who is not only seeing 45 people maybe across the course of a week, but is also not getting any benefits. They're not getting healthcare themselves unless they have 35 client contact hours, which is so many. You might think 40 hours a week. That's 35 is 5 less. It's not like that in this kind of work. But basically, I think these are practically unsafe working conditions for both the therapist and the client in these places. So we often fail people, and those people don't just disappear. And since the 2015 announcement, the Cook County Jail had become the largest provider of mental health care in the country, we know that many of these people are made to spend the rest of their lives shuffling through the American prison system instead. So all that to say, this is the kind of care that's available to the poor in this country.
Thanks so much. And that actually touched on one of my next questions, which maybe Yapa, feel free to answer this as well. I mean, I had a more hopeful question for you, but feel free to touch on either, which was going to be about the labor conditions for social workers or mental health care providers, because that's also an important piece of the puzzle for us as socialists. But my more hopeful question for you, Yapa, was going to be about what some of the best ways are to approach mental health prevention that you've seen or that you would like to see.
Yeah, really fast to piggyback off what Christie said. I remember at the last place I worked at, it felt like a mill. I felt like there were so many recently graduated, social workers who were just pushed into this, and they were giving X amount of clients, and the incentive was very capital. You had to like have X amount of clients to have a healthcare voucher, and even that was a huge caseload, and it was exhausting. And it shows how we as social workers, even as therapists in our offices, can still be exploited, right? So we're trying to ostensibly empower our clients, and we're also being disempowered. So I really echo what you were saying on that. As for preventative models, I think we need to always push for more low-income housing. That goes without saying. We should always pressure those in power to accommodate the creation of low-income housing, especially here in Lower Manhattan, where it's a real, everyone in New York City, but this is really bad down here. We as a culture still do not equate secure housing with mental health care and mental stability in the way that we should. I dealt with this with a lot of therapists, I'm sure you do as well. The slippery slope into mental illness from being unhoused is dramatic and it's quick. A person without consistent housing will likely fall into depression and then desperation. And that's not to mention the shame that, unhoused people feel, which then prompts them to make them less willing to be social, which then leads to them being antisocial. And once we have, these folks being disconnected from their networks, we begin to see the loss of our community fabric. I also want to add really fast, I think we need to really rethink the way we approach mental wellness in a way that isn't being taught in most early education right now. Most people see mentally ill folks on the street and they're quick to otherize them, but how easily that could be your loved ones or even you under the right circumstances. We live in a system where many of us are one paycheck away from being evicted. And many of us are genetically predisposed exposed to being mentally ill. And because of this, we need some educational reforms in which we as children can collectively learn how to become emotionally healthy humans. Our parents should ideally be doing a lot of this, but our parents aren't with us in school all day. We are forced early on to prioritizing consuming information and then regurgitating this information to pass our state exams, but we're never taught in a formal way how to regulate our feelings. Why not? Why are so many of our adults talented in academics and other fields, but emotionally stunted and underdeveloped? How can we collectively learn to negotiate stress, forgiveness, compassion in an intentional way within our system? And these are all afterthoughts because they typically arise during conflict, but it's always reactive to conflict. It's never preemptive to conflict. And it's rarely instilled in us before shit hits the fan. So many of our kids are not equipped to handle these stressors. So just in the way that we learn math and English and the arts, we really deserve to learn how to observe and regulate our own feelings as we develop, so that our kids can be truly well-rounded leaders when they're forced to enter the real world. Thank you.
All right. Thank you. So I think now we're like really, really open for questions. The questions that you all have brought here on these note cards are incredible. So thank you so much. Maybe if we can get on the screen our two Zoom panelists, Brynne and Phillip, so that we can see them and hear them if they decide to come off mute. No hurry though. I just want to really lift up something I've been hearing over and over again of like housing that is not conditioned on anything. It's not housing that you have to stay sober to stay in. It's not housing that you have to have a job to stay in. Is an incredible preventative tool that also everyone deserves. And that, like Yapa was talking about, teaching kids in school how to deal with their emotions and treat other people with respect, and taking the aggressive, violent policing out of our communities, like John was talking about, is another way to be proactive and preventative. And the reason I bring these up is because one thing that struck me as we were preparing for this, not by no means do I want to be like a hater on the nonprofit approach to either mental health care or public safety or politics in general, but sometimes it feels like when we're playing like whack-a-mole with issues and we work on mental health over here and then we work on housing over here and we work on education over here, then it's like all these different parts of the left or the progressive space are fighting for small slivers of the pie, working on these issues in isolation and fighting with each other when it comes to like state budget o'clock or city budget o'clock, for who's going to be able to have the win this year, rather than having this holistic plan for what is a different society we could envision and what are actually the things that are going to get us all to that win together. So really love that like the same things keep coming up. All right. I have so many more questions for all of you. I want to talk a little about rhetoric. I've seen this in so many note cards, and I don't know who's going to feel comfortable taking it. So raise your hand if you do, and if no one does, figure it out together. So we have these corporate Democrat executives in New York who often feel like Republicans. Our mayor and our governor, they have been so effective at weaponizing the crime panic to their advantage, and adopting the language of progressives for their ends, like talking about the need for services. And Daniel Penny, who killed Jordan Neely, his press release, this word for word, I'm going to read the press release that he released. He said, "For too long, those suffering from mental illness have been treated with indifference. We hope that out of this awful tragedy will come a new commitment by our elected officials to address the mental health crisis on our streets and subways." Which is, it messes with your mind to think that like we could have written those words in a different context. And so I'm wondering if someone can unpack for us, like, how are the bad guys able to so effectively tie together some of these seemingly left and right talking points, and why does it serve that? And what's going on here? Thank you, John, for taking the first really hard question.
So I'm going to start. Full transparency, I'm jumping at this question mainly, I think, out of a little bit of a knee-jerk kind of moment. So you all are going to get my thoughts as they process in real time. So forgive me for that. The thing that I've spent a lot of time kind of thinking about that to me fits with this theme is how successful they have been at othering these communities as a initial first step, because it's very easy to have these kind of rhetorical things about those people over there. And then when it's those people over there and you're divorced from them, nobody is that engaged to have that critical thought of, wait a minute, that doesn't actually make sense. Because it's a theoretical person, right? And that's been really frustrating for me, because the reality, especially when we're talking about, mental health and like, we have created, because there's such long-standing stigma against people who are having issues with mental health. It was kind of a preset, like it wasn't hard to drum up the othering. They just had to tap into something that has already been kind of within our society for decades, if not centuries, right? And so then what has happened is, we forget or turn a blind eye to the fact that, oh yeah, actually I knew someone growing up who had issues with depression, or actually my cousin had a diagnosis for, whatever, or I myself struggle like that. It's one of the most ridiculous things to me, because my guess is if we went across anybody in this room, you're maybe 2 degrees of separation, if not separated at all, from someone who has had some form of struggle with mental illness one way or another. And this idea that and if you haven't yet, you probably will within the next, like that's the thing, this idea of what it means to have some kind of challenge with mental health is not something that's necessarily a fixed label, like yes, you, or no. Sorry, still processing. So I say all this to say that by doing this, we've removed these people from our community, right? Instead of this idea of like, yes, there's a person who is struggling with whatever, we just decide like, okay, this is our circle and this is our bubble, and we're going to focus on that. And if I think you have some kind of struggle with mental health, I've already turned my back on you. And that's the part that I had come up to me a lot with this, because so many of these conversations, especially when it comes to a violent act, most of the people declaring the person who's struggling with mental health issue has no actual training to be able to declare somebody struggling with mental health or not, and has no idea how to recognize what that means. And so all this to say that I think that the point about, well, how have they been so successful at tying these narratives together? It's because they've already got us to kind of think, to kind of like exclude them from our community, from our circle. And so then when you write rhetorical narratives about people who you don't actually know or think about, it's just a passing thought. And I think that's what keeps kind of coming back to my mind.
Yeah, thank you. I see Brynne's hand up also.
I was going to say something similar. The part that got me the most was when it says on our streets and subways. To me, that translates to, we don't want to see them. We don't want them near us. it goes back to the history of ugly laws. It goes back to putting people, which still happens, into institutions. So I agree with that othering of the enemy at the gates mentality of that's them and we're us, and just being afraid of people you don't treat as your neighbors, and even though they are your neighbors. So I think it really points to getting them off the streets and subways means getting them away from us. And I think that's how, and people might feel more safe from being away from those who are dangerous.
And just to keep digging into this and into the tough stuff, someone has a question here about like in a recent New York Times article addressing this issue, the dominant narrative still is like, well, it is scary if you're on the subway and you're confronted with erratic behavior, someone who makes you uncomfortable. And so the question here is, what do we say to subway riders who feel this way? Not everyone is in this room right now having this conversation. And so as organizers, yes, we may be looking to the future Red Vienna or the future prevention initiatives, but also what do we say to those folks who may be in our families, in our communities, on our commutes? Yeah.
Yeah, this is a genuinely, I'm glad we're getting into the difficult stuff, because I think one of the reasons why the right has been so easily able to co-opt this language, as Alicia said, this could have been something that we wrote, even with the on our streets and subway, like maybe we would scratch that or something like that. But I think what the right is doing is pronouncing a problem that is widely, we are in a mental health crisis. And I think that's actually something that's very important for the left to acknowledge, and then to tie it to point to these correlations that Seth put and John put out, and to really say, yes, mental health is tied to capitalism and tied to class relations. And it's also, mental health issues are also correlated with poverty. And it's a very difficult thing to look at that. But if people are being abandoned by the economic system, they're more likely to fall into activities that are not legal. And of course, there's white collar crime that we're not looking at and calling illegal, and that's a very important part of it too. But looking at these correlations between poverty, capitalist class relations, and the kind of difficult positions that they put people in, and mental health issues, I think is a really important. This is simply a crisis that we have to be as loud as the right in saying this is a problem. Yeah.
All right, thanks.
So I totally agree with that. The one thing I would add is, like, to your specific question of what do we say to people who are scared of someone behaving erratically, change subway cars, right? That's what New Yorkers do. And don't call the police, certainly. Yeah. The one thing I just want to add to this is that while I agree with everything that you said, Christie, I think it's really important for us to understand what additional mental health treatment what problem that will solve and what problem it won't solve. And as has come up quite a bit, it is impossible for mental health treatment to be effective if people don't have stable housing, right? If it's a prerequisite for living like a minimally ordinary life is to have stable housing, to have a living wage job, and to have a supportive social network. And so we could give everyone the state-of-the-art, cutting-edge mental health treatment for free. And if we don't have enough affordable housing or social housing, there will still be homeless people, right? And so we need to just be very clear about sort of leading with the mental health treatment, which of course we should support, right? And we all want, but not letting that divert us away from things like social housing, living wage jobs, and so forth.
I just also want to say, I think that while it's a challenging space, but I also think that you want to hear people in their concerns, but at the same time, be willing to kind of challenge this idea. I think because the narrative is so deeply embedded, there's a knee-jerk association of like, this is uncomfortable versus unsafe. And I think that that's something that we don't challenge enough.
Absolutely. And I struggled with this and pushed back when we even named this event like Socialist Approach to Mental Health and Public Safety, because I hate that they are so often put together, but also they are often put together. And so we have to sort of live in the reality of the rest of the world and unpack sort of, like how do we, just like you're saying, push back that, okay, you can be uncomfortable. I'm not denying that feeling that you're having, but that also doesn't mean that you're unsafe. So I want to ask, I have a bunch of questions here, folks. Very excited, Phillip, to hear what you were talking about Red Vienna. And just curious, maybe for Phillip, and then if any of the practitioners want to also think while Phillip is talking, what lessons or structures could we bring from Red Vienna to our New York City today? Or I know you're in Chicago, and also what would need to fundamentally change about how our society is structured to be able to actually bring those things?
Thank you. The last one's a really tough one. Let's think about the lessons that can be learned first. And here I should acknowledge, we've learned a lot from this book. Some of you might know, by historian Elizabeth Ann Danto. It's a very valuable book on psychoanalysis between the wars and the kind of progressive socialist culture that emerged around it. And a couple of things that she points out that I think are really important in terms of lessons that we can learn is the way that mental health problems are framed. Because in many ways, in the interwar period, the entire way of thinking about mental disorders changed, partly in response to the social cataclysms of the war and its various aftershocks. It became very clear, that mental suffering was caused by environmental forces. And this then was connected to kind of the everyday violence experienced by people in the lower classes. And it really shifted the framing around issues of mental health and neurosis or psychosis. So there was kind of a radical break at this moment with the liberal individualist framing of mental disorders and also the moralist framing. And neuroses were redefined from being a personal trouble or a private affliction to a larger social issue. And that reframing had, direct political implications, because if it becomes a social issue, then it becomes the responsibility in many ways of the collective, of the state, to address these. And this fed directly into kind of the current of socialist and progressive forces that gave rise to the welfare states and to Red Vienna. And another point that she makes that I think is really powerful is that part of what happened in Red Vienna was that you saw a normalization of public mental health services. So some of the clinics that I mentioned, the Adlerian and Freudian clinics that emerged to provide free or very low-cost treatment to the lower classes, some of these were actually directly built into the Gemeindebauten, these massive residential complexes that the socialist government built, which made it very clear that these were communal resources available to everyone. And this played an important role, she argues, in destigmatizing mental health problems and making it clear that these were resources that everyone should take advantage of, and really the building blocks of a better life for all. One thing that I would add to that I kind of was alluding to in my presentation is that this remarkable ability of a powerful socialist movement to galvanize progressive, even left liberal, and a whole host of different sort of cultural and political currents and direct them towards more radical ends, I think is really striking at this moment, when even Sigmund Freud, a classical old school liberal by his own words, can start speaking like a socialist or social democrat in 1918, and people from across the political spectrum can do that. You know, it's partly a testament to different conditions, but also I think to the power that, you know, socialist or social democratic movement speaking to urgent material needs, you know, what that can do in shaping consciousness, and to formulating new political demands. So those are, I think, some of the broader lessons that can be taken from this. As to what we need to change in the present, I think I might defer on that part of the question.
Sounds good. We'll let someone else give it a shot. Anyone? That's okay. We have many, many more questions. And perhaps that gives us a good opportunity to transition to sort of the campaigns, tactics, options in front of us right now. A big theme in the questions that I am seeing is sort of tension between the short term and the long term. And so folks want to know, I also want to know, what are the good options we have in front of us right now? What government programs or initiatives are we seeing that we are excited about? Also, which ones are we seeing being pushed that we are not excited about? And then looking to the longer term, like, what are we building towards? What are our real socialist horizon goals and dreams? So let's start in the short term. Maybe I feel like Christie and Seth have both touched on this. So if either of you feel like you can take it, like both, what are you seeing that might be good, but also how can you tell and flag, like, what's a offer in the mental health space that actually is carceral, coercive? How can you smell that out? Yeah.
So I'll take a stab at it. So I think, and I think it actually gets to the earlier question about longer horizons, which is that so we need to decouple mental health treatment from the carceral state. They're intertwined. They're both forms of social control. Both involve systems of behavioral micromanagement and surveillance, particularly of poor people, in order to qualify for certain services, SSDI and so forth, disability services, and both involve systems of sanctions as well. And so I think in the short term, and to be honest, this is all kind of guided by the critical resistance and survived and punished, you know, reformist reforms versus non-reformist reforms. But I do think, you know, like, does it involve behavioral micromanagement and surveillance? Does it separate deserving from non-deserving people? I just totally lost my train of thought, but I don't know. Yeah. So yeah, so I think come back to me, because I just.
Okay, well, my thoughts will be very scattered, and we can go back to you at any point amidst them. I mean, for me, what comes first to mind always is Medicare for All. It's a fight that I've been involved in. I love the shirt I see out here. Represent. I think, though, you know, we're in a strategic lag when it comes to Medicare for All right now. You know, we saw an opportunity with Sanders' run for the presidency to maybe push for that and to galvanize people. I think it is really a non-reformist reform insofar as it pulls in people who would immediately experience a change to their everyday lives and see that politics has something in it for them. But we are unfortunately not at a moment where that feels like something that we have the political power even nearly approaching what we would need in order to win it. With that said, hey, today is the day that Bernie Sanders and Pramila Jayapal are reintroducing it into the House and Senate. So that's cool. But I think one thing that came to mind both in Phillip's presentation and something here that is I haven't seen anyone kind of pushing for this recently, but in countries, I know in Germany and France, there's a position for social workers in schools from very young age. And it's a very like seriously taken position of the psychoeducator basically, or the educateur socialisé in France, the person who's there specifically to raise to consciousness kind of social tensions, unconscious tensions. I think what's so great about psychoanalysis is that there's a confrontation with the ugly, dark, destructive forces that really brew in all of us, and then brings them to consciousness so that then people get the choice to either decide to go with that or to choose life and to choose community and to choose, you know, the richness that's possible when you kind of acknowledge those things and then set them aside. So there's something to be said, I think, for this position that doesn't even exist in the US. There was an effort in the 90s in Chicago, I believe, with some psychoanalysts who were trying to really get the state to fund social workers in this specific kind of position in schools. But it's an idea that I haven't really heard of talked about recently. But I think just like, oh, it was you who mentioned, like, what if we were trained, like given some formal education, and this really built that into, you know, it's just as important in geometry class to like recognize when you and your peer are getting into some kind of competitive tension that has nothing to do with math, but it's actually blocking your ability to learn as well. So I think this model is actually really rich and interesting, and maybe could go somewhere if taken up here. I don't know.
You really rescued me there. So the other 2 points I wanted to make were just, is it voluntary or involuntary, right? A lot of progressive or seemingly progressive reforms that do involve involuntary commitment, and we need to, you know, stay away from any process of reinstitutionalization. Treatment should happen in the community and should be fully funded in the community. And then does it provide actual material, does it improve material conditions for people, and are those improvements conditional on something? And if the answer is no, it doesn't improve people's material well-being, then we should probably oppose it. And if it's conditional, we should probably oppose it.
I also want to add really fast. We also need some reforms in our psychiatric hospitals. And as someone who did a program of chaplaincy at Bellevue Hospital, I was assigned the psychiatric floor. I went to the prison floor and I would see the conditions of these who were involuntarily there, and it was heartbreaking and dehumanizing. And we need to really start treating people as people and not as I don't even know what the prisoners. It felt so carceral. Yeah, it was terrible.
I'll just briefly add that I think we need to communicate all this. I'm hearing all these wonderful, brilliant answers, and part of a common thread here is that progressive and nonprofit groups dominate this space. And socialism is in part the prevention to mental health crisis, is what we're saying over and over. And I think we need to take back that space from progressive and nonprofit groups and assert ourselves. And this is a comms issue that we have the answer, we have the perspective, and we're not communicating enough for a variety of reasons, but this is a good next step for us to do that.
I will just use my facilitator privilege to add perspective from the harm reduction movement, which hasn't been brought in yet explicitly, but so harm reduction from people who use drugs is sort of really robust, rooted in bodily autonomy, in sort of the dignity of life, in sort of the autonomy of people to choose their own path and not shame folks for any choices they're making, but rather giving people the information they need to make the choices that they want to make. And so something that is like existing in New York City right now is we have 2 overdose prevention centers. They're the only 2 that exist legally in the United States. And we have legislation that is not moving at the state level, but could, that I think is really sort of a gold standard in this space, because what they do essentially is like an overdose prevention center is a place where you can come with your own drugs and then use them. And folks are there that are trained to both have like sterile supplies, whatever you need, and also to help in case of an overdose. And there have never been any fatal overdoses at any of the hundreds of overdose prevention centers across dozens and dozens and dozens of countries across decades. And they're not places that have put any conditions on your drug use. And so that's, I think, matches what a lot of folks have been saying. It's really cool. And it'd be really cool to have sort of like other versions of this in the mental health space. And I don't know what those are because I don't have that kind of experience. So cool. I'm going to turn it over for one great question from the Zoom to Eric. And then after that, pass it to Zach to wrap us up.
Sure, cool, thanks. And shout out to all the great Zoom questions that came in. I'm so sorry that it seems we only have time for one. But let's see, curious if the panelists could speak to the status of labor organizing within mental health clinical fields, and to what extent there are or could be formal labor solidarity between mental health clinicians and medical workers or other social service fields. And maybe I'll just add to that, like how and what opportunities are there for kind of organized, care workers, health workers, mental health workers to like make interventions in this exact kind of discourse and politics we're talking about.
Thanks. And shout out to residents on strike right now, maybe?
Yeah. I've spoken a lot, but I could definitely. Okay. There is an incredibly rich, beautiful, strong history of unionism amongst social workers that's tied to other helping professions, like civic helping professions, and it's forgotten or not talked about. I think we could spend an entire evening actually, and it would be very motivating, and it's something we should probably do, and talk about this history and talk about where we're at today, what we're missing to get to where people were in the 40s and 50s. So just that there is this history doesn't mean that, yeah, we can do it today, I think, but in brief, there was the Social Service Employment Union that was very active, I believe in the 40s and 50s, made huge wins in especially Chicago and some in New York in the 40s and 50s. The key things that they did, their demands, first of all, were very importantly, it's part of kind of social unionism. So they were fighting for not just living wages and the right to organize and to participate in the life and order of their agencies, which are kind of typical demands of any kind of workplace, but they were also making demands that impacted the people who they were serving, and they were involving those people in their own unionizing efforts. And so it's just an incredibly beautiful and kind of rigorous history that we should be looking to, I think, for lessons today. And they won a lot, both for themselves in terms of better negotiating positions for future contract fights. Other unions joined in a lot. So like a lot of other like teachers and medical workers and emergency services and I'm forgetting, I didn't totally prepare to talk about this, but as well as like salary increases and setting like standard caseloads, which is a huge issue. And really, I think, and getting a reserve corps of caseworkers that match 10% of the current number, so that you always have backup, so that you're never in a situation like we're in today where you're overworked and understaffed. What was I going to say? Something about, just like the importance of, I think, I kind of lost it, but I think working with the people who you're working to improve their conditions. What it was just the kind of what this did in this particular moment was really lit the fire under other workers who were unionizing, as like we've seen in the kind of strike waves of the past few years. I think this is a particularly good nexus, though, as we've been talking about the crisis of mental health, which, as we all know, is a crisis of so many other things that are a result of capitalism today. But really, I think galvanizing a force of people who are pointing to the core issues while, as Seth was saying, like immediately changing people's like material conditions. It's something that's like people in this profession are particularly well poised to do. Where we're at today is it's very difficult because there's been a move since the mid-90s toward kind of fee-for-service care. We're starting to see a trend in this reversal going back toward full-time employment. And I think it's something interesting that we should kind of stay tuned for what will happen in terms of workers getting back into the same spaces, into the same meetings together, maybe able to communicate and organize a little bit better in the places where this is possible.
Yeah, thank you. All right, I am going to turn it over to Zach because now everyone is appropriately curious. What do we do, not just in the long term, but like today? So we're going to get some slides up. I'm going to give you this microphone. Everyone has those flyers on your seats, or watch out for Zoom links in your Zoom chat because there's going to be a lot to do.
Hi, everyone. Thank you again for being here this evening. I'll stand here. No, this is fine. Thank you all for being here. It's been a really fantastic discussion. My name is Zachary Hendrickson, and I'm a member of New York City DSA's Racial Justice Working Group. Woo, yay. I use he, him pronouns, and to provide a quick visual description for those who need it, I'm a male-bodied person standing about 6 feet tall. I have brown skin, wearing black circular glasses, a black COVID safety mask, black skinny jeans, and a white button-down shirt with a patterned print made up of many tiny blue and black flowers. This has been a really incredible conversation. We've discussed a lot of big ideas this evening, really big problems. However, the organizers of this event didn't want to just leave you all with a better understanding of the problems we face as socialists concerned about mental health and public safety. We want to make sure that we provide some tangible next steps that all of you can take right now to start moving toward more healthy, supportive, and just communities. So yeah, woo, we love those things. So we have to start by remembering that no one person or one group is capable of single-handedly dismantling global capitalism. We've talked a lot tonight about all the many, many big structures that need to be completely changed and overhauled in our society in order to make it a more just and equitable place. And that's not going to happen from any one individual. That is a capitalist urge, a white supremacist urge, and we have to resist those things. And so it's going to take all of us. It's going to take all of us fighting the fight wherever we are all the time. That means whether that's your job, in your apartment building, at your school, or on your block. So to undo the terrible grip that capitalism has on our bodies and our minds, we have to push back against its isolating, alienating, and atomizing tendencies to build meaningful relationships and powerful working class organizations with the people all around us. Yeah, thank you. So if you're thinking, okay, sure, like that still sounds like a lot though, you're right, because it is a lot, but that's why we're not going to do it alone. And we're going to do it not all at once. So I have 4 steps up here. The first one may look familiar. So I certainly don't have all the answers, but when faced with big problems, I often find it helpful to focus on the parts I can control, or at the very least, the parts of the problem that I can directly influence. And as I said, anyone who's been in therapy, that probably sounds like really familiar to you. But what can we as socialists influence right now? Yeah, next slide. The city budget is something that we can influence right now. Eric Adams and his cabal of these billionaire corporate real estate moguls are determined to hollow out and strip away all the resources that make this city great. We're talking over $500 million, that's billion with a B, $500 million in cuts to public schools, and another $500 million from 3 through K education, functionally ending the promise of universal early education for New Yorkers. Another $168 million cuts from CUNY, $36 million in cuts to our libraries, $46 million in cuts from our parks, and so on and so on and so on. Anything that you care about, Eric Adams is basically trying to take it away from you. Boo, Eric Adams. We hate Eric Adams. Exactly. All the while, our cop mayor, Eric Adams, has somehow found the funds to approve a massive retroactive raise for all of his friends in the NYPD. That is boo NYPD, exactly. Yeah, and this retroactive raise is going to cost all of us as New Yorkers $5.5 billion. That's on top of their already absurd $11 billion annual operating budget. But also their operating budget doesn't really matter because what they put on paper isn't what they follow. Mind you, this is the same NYPD that's known for assaulting protesters, protecting anti-abortion goons, and that has already racked up nearly $500 million this year alone in unapproved excess overtime. Mind you, $500 million already, and we're in May. Just in their excessive overtime alone, that could cover many of the cuts that I already told you about. So what's the easiest thing that you can do? Once you've identified sort of like, okay, what can I influence? Start with the easiest step first. So the easiest thing you can do right now is you can use the link on your screen. That's socialist.nyc/fight-austerity, or you have it on the piece of paper that was on every single one of your seats. You can use that link, go to that link, and it'll allow you to send a message to the mayor and your city council member demanding that they follow the People's Plan budget priorities, all about investing in community care, not cops and mass incarceration. That's the easiest thing you can do right now to make your voice heard. You can also register to take part in the next slide with the Care Not Criminalization March happening on May 24th. It will be a great way to get on the streets and make your voices heard at a crucial time during the city budget deliberation process. This is being put together by Communities United for Police Reform, the People's Plan, many other groups of which New York City DSA is a coalitional member. And lastly, I want to address my last 2 points from the previous slide about collectively identifying root causes of harm and getting and staying organized. You're already doing some of this work right now, so I want to applaud all of you for being in this room. You're a critical part of the solution to all the problems that we've already identified tonight. But it's not enough just to come to an event like this. I want to make sure that you continue to channel this energy into sustained community organizing work, which is why I'd like to invite all of you to join the Racial Justice Working Group on Saturday, May 27th from 1 to 4 p.m. for a vigil and teach-in for Jordan Neely. It's critical that we as socialists don't allow Eric Adams and the dozens of other capitalist lawmakers off the hook. They are the ones who created the political and material conditions that made Jordan Neely's murder possible. They have blood on their hands just as much as Daniel Penny. In life, Jordan deserved better, and now he deserves justice, and that means building life-affirming systems for all New Yorkers so that something like this can never happen again. Thank you so much for your time, and I really hope to see you there. Yeah.
All right. So first, I just want everyone to give another huge round of applause for all of our panelists on Zoom in person. Thank you so, so much. I want to encourage everyone right now to put this link into your phone, bit.ly/after-town-hall. That'll take you to a very incredibly quick survey that's going to ask you for feedback about this event because, as I said, it was our very first one. And also, it'll ask you if you want to join the team to help put on future town halls with New York City DSA. So just load that up right now so you can do it right now or on your train ride home. The other thing is on your screens or on your chairs, there's a Cash app where you can donate to help creating these town halls. Also, if you're not a member of DSA already, or if you haven't given money to DSA, consider doing those things. And last but not least, a big thank you to the People's Forum and all the staff that are here tonight helping us out. And to everyone that helped put this together that isn't on the stage today, Jack, Renee, Simon, Paul, Zach, Kristen, who wasn't here, but really did a lot, and Eric and Aaron. Thank you so much, all of you. This was really a joy to put together. Thank you, thank you, thank
And
you.
special
everyone.
thanks to Alicia, the
Oh,
facilitator.
Very sweet.
MVP.
So it is 8:41. I think we're going to close out the Zoom for folks in the space in person. We've got to be out the door and cleaned up before 9. But if you want to hang out for like 5-10 minutes, chat, say hi, drink some soda. Please stay and make community. Exchange phone numbers with each other. Thank you so much. Have a good night.
Bye.